All right, so with the remaining 5 minutes or so, I'd like to wrap up and talk about what's to come. Next slide. So shown here are the contact information for CPCQC as well as for Illuminate Colorado. If you would like any more information related to the efforts that were presented at the beginning of the session, such as the perinatal behavioral health related funding projects or the various policies and programs and the groups that are working on the SEN 2021-2022 priorities, please reach out to the emails that you see listed there. Next slide. Now for Chosen Quick, in particular, we've heard a lot about our need to expand beyond the birth hospitalization, and that's exactly where we're headed. And so we are moving beyond opioid-exposed newborn care to substance-exposed newborn care. For the hospital teams that have already engaged in this work, I'm sure you've received emails from our analyst, Blair Weichel, already, that we are adapting our centralized data system and asking that you now enter data for substance-exposed newborns more broadly and not just opioid-exposed newborns. And we completely recognize that this likely will add to the data entry burden. If this exceeds your bandwidth and your capacity at your sites, please do reach out to us and we will find creative ways that we can support your work. Prenatal engagement. You've heard a lot about navigator programs, care coordination, family supports, and that's really just a part of it. I'd love in the future to have Lori Halmo, who is one of our physician champions in Chosen Quick, also speak, because she's developed a program on self-referral in the emergency department. As we heard from Dr. Krantz, a number of women with substance use disorders during pregnancy may never be linked in to prenatal care, but in fact may come in for emergency care. And that presents an opportunity to connect these women to other services. And so Lori Halmo is developing a self-referral program using QR codes in the emergency department. So more to come on that. Certainly the work of CPCQC and the AIM opioid use disorder program and their bundle will continue. And we hope that more hospitals will participate. We need to engage more effectively with our MAT providers. Well, first of all, we need to ensure that birthing individuals with substance use can get access to MAT. Secondly, I think we in Chosen Quick need to find strategies to work closely with these MAT provider groups such that we can engage with these pregnant women before birth hospitalization and really to provide good anticipatory guidance about what's to expect during that birth hospitalization and then what safe discharge looks like. And then transition home. We've heard in the past from Lauren Bruns and her work around plans of safe care. And really our hope is that with the development of the navigator programs, the plan of safe care becomes a living document that starts as early as possible with the help of this navigator and that is carried through beyond the first year of life of that infant, such that there's a clear understanding from the beginning of pregnancy through that first year of what systems and supports are in place for this family, what has been accessed and what still needs to happen. Engagement with outpatient providers. Again, you've heard me say it repeatedly, we don't have good data on what happens post-discharge. We're starting to get at that with our work in the data linkage project, working with the University of Denver and the co-lab there, but it's really more at a population level. There's a bit of a data lag of about 2 to 3 years. And so it would be wonderful if we could develop new programs to engage with outpatient providers in real time so that we get real-time feedback about what the family's needs, either met or unmet, are after birth hospitalization discharge. And I'm really thankful to several people on our steering committee that are expanding that particular work. And then lastly, we talked about this as well, that birth hospitalization, pregnancy is not enough, that we need to think about creative supportive services for families in the first year of infancy so that there's really good wraparound services for these families. We know that maternal mortality is the most likely in that first year, and it's not, as I said, in that first month after birth, it goes all the way through the last 9 to 12 months of the first year of life. We also know that substance use may stop during pregnancy and then astronomically increases that first first year postpartum. So clearly our families are experiencing a tremendous amount of stress. And so we do need to find strategies to reach out to them and to make our services and our support accessible for families, even in the most remotest of areas of Colorado. Next slide. This is a model of care that was put forth by the Institute of Healthcare Improvement. You know, IHI, for many of us that work in healthcare, are sort of the big entity that really focus on quality improvement work. And back in 2016, they put out this document that really sought to conceptualize a medical home for mothers. So a maternity medical home for birthing individuals that goes through that first year postpartum. And while this was focused for the general population, and their emphasis was that every woman should have each of these key operational elements, I'd like to highlight that for our birthing population with substance use, these key elements are even more critical and likely will require even more targeted, more creative strategies to make this happen. So IHI says that every woman should have a standardized risk assessment to identify needs, focus on early entry into prenatal care, good care coordination, standardized care pathways that target common risk factors for poor birth outcomes. And for this, I absolutely would consider, you know, social determinants of health, and the work by Amy Dempsey and her group having that social determinants of health almost dashboard type thing within their EMR is amazing. IHI also calls for enhanced access, expanded hours, improved ability to actually reach providers directly. And then, of course, being patient-centered, truly shared decision-making as a central tenet of perinatal care. And you can imagine, absolutely essential for every woman, and even more so for women with substance use who need to develop really trusting relationships with the healthcare system in order to ensure optimal outcomes for themselves and for their family. Next slide. And so, as mentioned, the chosen work is truly a collaboration between the organizations, among the organizations listed there. Before I conclude, I do want to highlight the service of one particular individual. So, you know, moving forward, I think we really want to hone in on individual hospital teams, and within the hospital teams, individuals who really make things happen and go above and beyond their job description. And so there's one particular person who has been brought to our attention from the Valley View Health System. So this is Lily Larkin. I don't know if Lily is on right now. I know I saw Mick earlier, not sure if Lily's on, but Lily is a Spanish bilingual licensed clinical social worker who was at Valley View and you know has left, but repeatedly the Valley View Chosen Quick team has said that it is really because of Lily that their birthing individuals are open, are vulnerable, trust the healthcare system, and that it's because of her engagement with these families that there's such good follow through, that the families continue to be in touch with her, and that she's able to really be a navigator and a support throughout pregnancy, during birth hospitalization, and the first year postpartum. So I really do want to give a shout out to Lily Larkin. And then lastly, for this meeting in particular, shout out to Cassie Davis. I hope she presents herself and starts her video. I mean, this could not happen. This meeting could not happen without her finesse and her expertise in keeping us organized. And then next slide. And then lastly, it's time for feedback and evaluation, and Cassie will be entering, she already has an evaluation survey. And so we want to ensure that there's 100% response rate for those that have participated today. And so to give you a bit of an incentive, for all those that do complete the evaluation form, there will be a random drawing. 3 selected will receive a $50 Amazon gift card each. All right. And so as we conclude, do not leave the meeting, keep the meeting on and fill out the survey, because Cassie's going to kind of play some good 80s music to inspire you all to fill out that evaluation form. Thank you all again so much for sticking it through for 4 hours. I hope this was a fruitful time for you, and we always appreciate your hard work. Thank you, and have a great afternoon, and fill out that survey.